right, so we're going to talk about lung volumes and capacities. Your textbook also outlines these volumes and capacities on page 465 and 467. These are the six that we're going to look at, four volumes and two capacities. Your textbook has two additional capacities, but we're not going to worry about those. We're also just going to talk about the definitions or explanations of them. You don't need to know the numbers. That's fine. Don't worry about the numbers. It's kind of cool to look at because you see, you can think about it even just in terms of water bottles. So, like the little Poland Spring bottles are 500 mils, and so that's going to be your tidal volume versus your total lung capacity can be up to about 6 liters, which is quite a bit. So let's talk about what all these mean. The first one is your tidal volume. Your tidal volume is the volume of air that enters and leaves your lungs in one respiratory cycle. So that's inhaling and exhaling once each. That's just your normal inhale and exhale right now. It's not as much as you can breathe. We'll get there. It's not as much as you can exhale. It's just a normal inhale and exhale. That's your tidal volume. Then you have your inspiratory reserve volume. So this is the maximum volume of air that you can take in a really, really, really deep breath. So the deepest breath you can possibly take, this is your inspiratory reserve volume. It's after your tidal volume, so it doesn't include what the normal inhale is. It's your absolute maximum deep breath. Kind of the opposite of that, we have our expiratory reserve volume. So this is the maximum volume of air that you can exhale or expire after your normal resting exhale. So if you breathe out right now without taking a deep breath in, you just breathe out everything you can possibly breathe out, that's your expiratory reserve volume. But we can't breathe out all of the air that's inside our alveoli, that's deep in our lungs. So that is our residual volume. This is the volume of air that's left in your lungs after we breathe out everything that we can possibly breathe out. So I guess theoretically, if we were to try to get this air out, when you deflate your air mattress and then you kind of fold it and roll it to really push all of the last air out, that last air that you're pushing out, that's your residual volume. But we can't get that out of our lungs through exhaling. So those are your four volumes. Then we have two capacities we'll talk about. The first capacity that we'll talk about is your vital capacity. This is the total amount of air that you can exhale after the deepest breath you can inhale. So you take the deepest breath you possibly can and then exhale that breath as much as you possibly can. So it's everything you can inhale, your inspiratory reserve volume, your everything you can exhale, your expiratory reserve volume, and your tidal volume. So it's all the air that you can possibly breathe in and possibly breathe out. It's everything except for the residual volume. And so that's where we have total lung capacity. Total lung capacity is the absolute total volume of air that your lungs could possibly hold. So it's everything you can breathe in, everything you can breathe out, your tidal volume, and the residual volume that you can never breathe out. It's absolutely everything. So why do we care about this? We care about it because, once again, it's all about the transport of oxygen. The more oxygen you can get in, the more efficient your body can be at delivering oxygen to the rest of your body. Of course, you also have cardiovascular health, and so that needs to be good in order for maximal transport of oxygen. But the first step is getting that oxygen in. So in exercise and training, we look at increasing our vital and total capacities, increasing the amount of oxygen that we can get in so that we can be more efficient. You can actually train this. So the one on the left that you see, that's a spirometer that's usually used at home, and you can use that for training because you can actually change the volume of air that your lungs can take in. On the right over here, you'll see what is usually used at the doctor's office. It's a spirometer again. They have you breathe in the max you can breathe in, breathe out the max you can breathe out. They measure tidal volume, so it's a little more advanced. They'll usually use that when looking at disease. So there are a ton of diseases that can negatively affect your lung volumes and capacities. Things like COPD, emphysema, asthma, bronchitis, lung cancer. So there are a lot of different things that can affect your lung volumes and capacities, whether positively with training. So athletes usually have a much greater lung capacity than non athletes, or if it's negatively affecting it, like disease.